Hi folks, I'm John with the Pain Cure Clinic. Today's episode is about Lyme disease, which millions of Americans have been diagnosed with, but it's not clear to me or many of them that that's actually what they have. So I'm going to give you some much needed clarity about this disease and show you how to cure whatever symptoms that you have. So hang on with me for just a minute and I'll explain exactly what's going on. So Lyme disease, named after a small town in Connecticut, starts with a tick bite, and the bite leaves a red circular rash like this. Some ticks carry bacteria, and the theory is that the bacteria causes many of the chronic symptoms. But right up front, I want to tell you that Lyme disease is actually the tale of two diseases. One is definitely real, but the other, in my opinion, is very sketchy. Here are the two types. Early disseminated Lyme infection is real because its hallmark symptoms are a red circular rash and a tick bite. Both are acute and can be observed visually by the patient. Early Lyme has limited symptoms over a limited period of time caused by a real event, i.e. a tick bite. Symptoms include fever, chills, and short-term body ache. Now, late disseminated Lyme is what this video is about, and that's what most people have. Late Lyme supposedly occurs several months or years after the bite. The symptoms are not limited in time or scope and include just about anything. Here's the short list of symptoms listed by Wikipedia for late disseminated Lyme. And there are many, many more Lyme symptoms. So when I first saw the list, it raised a big red flag because I recognize all these conditions as being stress-related. So that led me to wonder whether late onset Lyme even exists, or is it just a collection of unrelated symptoms? I did some research and here's what I found. Now, Lyme is diagnosed based on three things: symptoms, possible exposure to ticks, and laboratory tests. And the only symptom that indicates anything clearly is the rash caused by the tick bite. Now, we've coached dozens of people who've been diagnosed with Lyme, and none of them had the rash or remember being bitten by a tick. Doctors seem to ignore the lack of evidence and label it as Lyme anyway. Now, about the lab test for the bacterial antibodies associated with the tick bite, the New England Journal of Medicine says this: a positive antibody test result does not prove Lyme disease. And then it goes on to say, because as many as 20% of the general population who are not infected have antibodies against Lyme, people without symptoms suggestive of Lyme disease should not be tested because a positive result would likely be false and then lead to unnecessary treatment. Now, if you try to follow the logic here, you can see there isn't any. Neither the symptoms nor the lab test are unique to Lyme. The diagnostic process is more like a guess, and yet they use it and put labels on patients that stick with them for the rest of their lives. I think it's bad medicine. And in fact, Dr. Paul Ottwater, professor of medicine and clinical director of infectious disease at Johns Hopkins University School of Medicine, seems to agree. Now, he managed a large 14-year study that evaluated patients diagnosed with Lyme disease by local physicians throughout the Baltimore area. Now, according to the study, 72% of the previously diagnosed Lyme patients did not have the disease at all, and another 11% had only a remote possibility of having the disease. And the other 17% did test positive for the antibodies, but as we learned from the New England study, up to 20% of the general population have the antibodies, so an antibody result of positive proves nothing. Now, Dr. Leonard Segal, clinical professor and chief of rheumatology at the Robert Wood Johnson Medical School, also agrees and says, if you go to a doctor who believes Lyme disease is every place and everything, then you'll be diagnosed with Lyme. And there are plenty of those doctors around. In fact, going back to the previous article by Dr. Ottwater, he goes on to speculate, and I think this is huge. It's unclear to me whether Lyme disease even exists. Wow. So if you've been diagnosed with Lyme disease, don't fear because you most likely don't have it. It's a label you can feel free to drop right now. I personally, after doing the research, don't believe that late onset Lyme exists. What you probably have are a collection of psychosomatic symptoms that are being created simply by stress. You're just stressed out and has nothing to do with tics. Doctors are not trained to treat stress and they can't bill insurance for it. Now, you're probably new to the idea of psychosomatic chronic illness, so let me explain the basic premise. The elevated stress of modern society leads to the continuous activation of the autonomic nervous system, which creates continuous physiological responses in the body, like inflammation and muscle contraction, as well as a constant release of the stress hormone cortisol. And that stress response is known to create all the previously listed symptoms that have been categorized as Lyme. Now, there are 3 action items for curing and eliminating symptoms permanently. First of all, you have to change your belief away from the doctor's diagnosis of Lyme, and then you have to reduce your overall stress and tension level. And then finally, most people need to increase their physicality because that'll reduce the stress. If you'd like more information on the topic, please hit the subscribe button and check us out at paincureclinic.us. There is a link below, and feel free to leave questions and comments. I will respond to all of them. And thanks for watching.